How you doing today? Trust you're fine. I decided to be more intentional, and there's no going back to it. Okay, so thank you for joining. Thank you so much. I really appreciate you. I decided to go out on this Ask the Nurse series, and it will be ongoing. I'll be coming up live to answer questions as much as I can, and where necessary, give some advice based on my level of knowledge on best actions to take. I'm not your medical practitioner. Definitely, you would go and see the doctor and do what's necessary. But basically, as a nurse, I am passionate about public health, and it's necessary I share information that can help you prevent a disease. Of course, we know prevention is better than cure. I've been carrying out some outreaches around my location just to create an awareness, so that with this awareness, people can do get make better choices about their health, be well informed, and then prevent certain diseases that are preventable. So right now I will be going straight to some questions that people frequently ask about blood pressure, because I really want to treat that and ensure that we have a better understanding on it for better health outcomes. So first, I'll be answering, what is blood pressure? Now, blood pressure is the force of blood pushing against the walls of the artery. So people think it so much. We don't want to think it so much. It's just like, because we know blood is liquid that flows through the body. So definitely it goes under a pressure. And that pressure is what is referred to as blood pressure. It is measured, in millimeter mercury and the rest. Then now people ask, what's the normal range? From records, we have that range of 120/80, like statutory 120/80, but it varies over time. So I, like the last outreach I did, I made it clear to them that there is an up number and a lower number. Thank you so much. Thank you so much. So please, you can just double tap on your screen to like this live show. I wouldn't be spending long on it, but I want to offer a little value, and then I'll be giving room for. Thank you, Tyson Gaming. Thank you, Makinda Dams. Thank you. I'm so grateful you're here. Actually, I'm just answering questions on health, and basically today I'll be talking on blood pressure. So you are free to ask me any question, but your questions on about blood pressure, I will be sharing some questions here and also dropping some idea of what I think about it. Now, you will be asked, like sometimes people wonder what causes blood pressure. It's so common now. A lot of people are having their blood pressure is high, because most times we have more high blood pressure than low blood pressure. It's usually a bit dicey. So someone asked me sometime in the last outreach where I was, and the person was like, between low blood pressure and high blood pressure, which one is the worst? Okay, there, here is how I answered that question. Actually, we are not want to be in any of the extremes. We want to be in the normal range, you get. And of course the normal range for the systolic, because systolic, that's a higher number when you have your blood pressure reading, is when the heart contracts. So the systolic now has these readings of between the range of 100 to 120. Some school of thought extends it to 130. I don't know if you are getting me. Then the diastolic now has the range, that's the lower number when the heart muscles are relaxing. That one now ranges from 60 to about 90, 100 thereabouts in millimeter mercury. So now that question the person was asking me during that outreach I went, a blood pressure awareness campaign. And to even drop that, in that outreach I discovered that out of about 70% of the persons I checked in the outreach during the procedures, had high blood pressure. Some of them knew about it, some did not know about it. And some of them became curious. Okay, okay, now I'm aware. What do I do? So I advised them on necessary steps to take, okay, to avoid, to engage in exercises and rest. Some were quickly asking what drug. Please, that you check your blood pressure once does not mean you should take drugs. No, it's a procedure. You must first of all go and see a medical doctor, go through some procedures. It's over time that they will prescribe drugs when necessary. But first of all, for me, because I'm on the preventive side, I would always advise lifestyle changes. So engage in exercises, so that you can build yourself up, and that way in exercises. Because now, okay, I don't want to skip answering that question. So I told her that based on my experience as a nurse in the hospital, I have observed that yes, high blood pressure is one of those aging diseases that comes up as people get older, or maybe due to their lifestyle, but mostly among the age. Then, but the low blood pressure, the very serious one, when it becomes a challenge, the low blood pressure. Oh, thank you, Catalina Rival. Thank you for joining. Thank you, Sahikana. I'll be entertaining your questions, so you can drop. I'm answering questions, frequently asked questions about blood pressure. Pooja Davi, you're welcome to this show. So back to what I was saying. So I had to explain to her that most cases of low blood pressure I've seen in the hospitals around me as a nurse, especially in those elderly ones, they maybe they once had a high blood pressure and now it's dropping. For me, what I discovered from their history, like current history based on the low blood pressure, it was a sign of heart failure for them. So I answered that question that for me, low blood pressure in some critical cases may be worse, because it can be a sign of heart failure. The heart is not even wanting to pump again and the rest. So that's it. So what causes high blood pressure, if I'm asked? There are several factors. Some people say it runs in races, like hereditary. When people take high salt intake, all these crepes and fast foods, most of them are so salted. You go to the supermarket, you see salted cashew, the rest. Excess intake of such can also affect. Then lack of exercise. Most people are in sedentary lifestyle. They are just sit. You sit in the car, you sit in the office, you sit back in the car going back home, you get to the house, you sit in the parlor, from the parlor you sit on the bed or you lie down, and so on. So they are really less active, and without excessive activity at their workplace, they are sitting down on the computers and the rest. So lack of exercise can affect us a lot. Another one is overweight. Being overweight, that's another set altogether, and that has to do with more about lifestyle. Like, although I've seen people that are not so weighty but having high blood pressure, that there are some other underlying causes, but overweight most times brings high blood pressure. Then smoking, uncontrolled alcohol intake, and so on. Some other chronic conditions can lead to high blood pressure, like kidney diseases can lead to high blood pressure. Okay, so now I when I was actually on that outreach, and I was asking some persons, like, okay, what are the signs you feel that makes you feel there's something wrong? Maybe because some of them were already aware they had this issue of high blood pressure. Okay, one of them said, I have severe headache. Yes, headache is one of the signs. So I had to take time to explain to that lady that the reason why it is so, why she feels that way. Number one is that the blood flowing is coming with a very high blood pressure, right? And then imagine moving from, let's say you have two pipes connected, and one is a wider pipe, and then the other one is a bit narrow. You will notice that there will be, and then the flow of the fluid passing through the pipe is coming with force. You notice that at the junction between the narrow and the wide one, it will be more fierce and the rest, and it can even burst open the narrow one, because the pressure is coming so forcefully into it. It can try to expand it, and where expansion fails, it will just burst. Okay, so now I'm trying to explain why it leads to headache, why a tell sign of high blood pressure is headache. In the brain, the vessels of the brain are very narrow. They are very, thin compared to the ones that flow through our hands and other body parts. They are very, very narrow. And now, if the blood pressure is very high flowing to the brain, it comes in contact with that narrow vessels, and the pressure there leads to that headache, and many people come down with headache and so on. So it's some people may be going about with high blood pressure. Some of them just overlook the headache and say stress, but it's a tell sign that something is wrong. They need some rest because of too much, needs to settle, sort around. People want to make ends meet and the rest, but it's necessary. Work on it. Now, why is high blood pressure dangerous? Why is it dangerous? One, it can damage the heart. When the pressure is too much, you just imagine a machine screaming, screaming, screaming. At some point it will just blow out and it's gone. So it can damage the heart when the pressure is so high, leading to heart failure. There have been cases of heart attack, people collapse. And that was more one of the things I held so much, for the reason why I encourage them to join the campaign of blood pressure awareness. Know where you are in your blood pressure, know the necessary adjustments you need to make, and the rest. So then we have brain. It affects the brain, causing stroke. You see most people who have very high pressure at some point, unchecked, unmanaged, maybe they are not controlling it and the rest, taking their medications, they come down with stroke and it affects them. They have the kidney failures and the rest. So all this affects the heart. So like I said, I'm answering questions as regarding blood pressure and the effects and the impact on our health. So if you have some personal questions you want to share, you can just drop them in the comment box and I'll reply as much as I can based on that. I'm also relating it to questions I got during an outdoor outreach on blood pressure campaign, awareness campaign. So then it also affects the kidney. Of course, we know the kidney filters blood. When the pressure is so high, it affects it, and then a lot of, it causes a lot of challenges, kidney failure, and then when the kidney is failed, it affects the whole body, and then you see slow degradation in health. Then the eyes affect the eyes, of course, pressure in the eyes, pressure and so much. When the high blood pressure is high, it can cause even more harm to the eyes. So now, what are the warning signs? I want to share some warning signs when you start having very severe headache. Very severe headache. Yes, I understand that headache can come as a result of a sign of some other diseases, like maybe fever. Some people have headache, some stress and the rest. But when you are beginning to consistently have very severe headache, it's necessary you do a blood pressure check. If you have the machine at home, check, just know what your readings are. Then when you're beginning to have chest discomfort too is a sign. Sudden weakness is also a sign. When you begin to have blurred vision, you're not seeing clearly, it's just like everywhere is cloudy. These are signs. So take note of these signs. Most of the people I reached out to during the campaign, the blood pressure awareness campaign, talked about headaches. They knew, they could tell once the headache start that yes. And if they check their readings, it's usually very high. At some point, one of them said she was even given a medication to immediately bring it down. So now the next question some persons are asking is, how often do I check my blood pressure? For adults, at least once every 6 months if you are not hypertensive. When I mean hypertensive is that you have checked and it's high, and maybe you are even on medications to monitor and control it. For those people, they have to check as often as every day to know where they are. As often, as long as it's in your house, just quickly check. You can make it a morning routine to check what your blood pressure is, and then you are on the go. Then while for the others who just want to know where they are, who are not really that hypertensive or on any drugs for control, they can just check at least once every 6 months. But it's not limited to that. You can check as often as you feel necessary. Yes. It's necessary to check. Just check, know where you are, especially when you notice some changes in your body. Like I said, the signs, severe headaches and the rest. Can stress alone raise my BP? Yes. Yes. Oh, Sarah Martins, welcome. I'm answering questions, frequently asked questions. Welcome here. You are really highly welcome. I'm asking frequently asked questions about blood pressure. And if you have questions, you can just ask, drop on the comment points, and then we would answer together. I'm asking, can stress alone raise the blood pressure? Yes, stress can raise the blood pressure. Whether emotional stress, physical stress, it can cause temporal spike. Yes, it can trigger that high blood pressure. That's why it's advised that we take some rest from activities that are strenuous. We should not just always be on the go. Our body, we are not machines, so we should not always be on the go. We should take our time to, rest, like give ourselves breaks. That's why in our regular works we have time for what they call vacation. Go out, relax, learn to relax, just feel good, stay fine. Just every day must not always be work, 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 because we need to be healthy too. So next question: do young people develop hypertension? Yes, that question is yes. People ask me. Yes. Oh, thank you, Pat. She did. Thank you so much for joining. I'm doing fine. Thank you so much. I really appreciate you. I'm answering on this live stream. I'm answering frequently asked questions on blood pressure, and if you have such questions, you can answer. Because like I said earlier in my introduction, a nurse, a registered nurse, and I'm passionate about public health and also on ways we can promote health and prevent diseases. It doesn't always have to be drugs, drugs, drugs. There are lifestyle changes we can make. So is does young people develop hypertension? Yes, I've seen it in the hospital. Over time, with my experiences in the hospital, I've seen young people come down with high blood pressure readings that you'd be like, wow, what's going on here? Yes, it's possible. Although with the physiological effect, it's supposed to be common with the elderly. Yes, because I explained that during the outreach I was at on Monday. I explained that why it is so. Why is it like high blood pressure comes in the later life? Is and then I told them, okay, have you wondered why when they go to the hospital they don't really bother so much to check pediatric blood pressure? It's not really a concern. But whenever an adult, someone considered an adult, like say 18 years up, or maybe in some rare cases some pediatrics, but they are obese. Now remember the risk factors I told you, then they begin to check their blood pressure and the rest. So I explained that on that outreach, that because the heart has been pumping, pumping, pumping 10 years, 20 years, 30 years, 40, 50. So just imagine a machine that has been working for that long. Definitely at some point it will begin to wane and wane, and it will now need a lot of, even if you have a machine in your house that has been working for so many years like that, if there is ever, because the heart has always been doing this from life first cry, from when you first gave your first breath till now at this very moment. So that's why at that, as the individual begins to age, it's begins to show up. Just blood pressure readings begins to go show up and the rest. So I decided as an individual, and I'm going to be sharing with you that I believe seeds are sown, and when they germinate, they bear fruit. So how they are sown at the moment now helps how their outlook will be at the end of the day, the yield, right? When you sow the seed, if you sow good seeds, they will yield better yields and the rest. So I believe that for every young person listening to me this evening, should start cultivating healthy lifestyle, like exercise. And it's when you talk exercise, some people think it's one big thing. No, 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 no. You can just start fix it to a routine. I'm not insisting that it has to be every day. You can just fix the one that works for you, but be active, exercise. If you start the lifestyle changes, it helps you. If you notice people who in their youth were very active, they stay older and they have less of these blood pressure issues compared to those who in their youth did not, take care of all these lifestyle changes. So young people come down with it. We have young people even having cardiac arrest due to very high blood pressure. Is high blood pressure curable? That's another question. Is it curable? Okay. Now, for many people, it can be controlled. Yes, I did a research. I had a colleague, a friend of mine, and I decided to do this research with him. Already, he has a history, like in his family, there's this history of high blood pressure, father, mother, and the rest. So that day, I decided to just, I check randomly because I just believe all these things, awareness should just be there. Just know where you are in your health status. So I just checked, and it was high. I think then he had 150, is it 100 or 110, thereabouts. But it was a bit high. And it was just in the morning. So then he now said, Kai, he has this history. Oh. I said, okay, you have this history, right? Okay, let's look at we because now I did a research, and then I saw that the athletes, those sports, name them. Okay, I'm not so much into sports, but at least I know some names like Leonardo, Messi. I don't know. Please don't laugh, oh. But I know some persons like, oh, I don't know why their names are skipping my head. I'm not such a football person, but I know Messi. At least if I don't know somebody, I know Messi. Yeah. I don't know so much. So let's talk about those sports people. Those who engage in different kinds of sport. The research showed that their blood pressure are usually at normal ranges, like usually on the lower side. They don't usually have that struggle. And then further research shows that due to the exercise they engage in, it kind of strains, it not really, I will not use the word strain, for better words, it kind of helps the heart muscle to be more elastic and developed to work effectively without strain, without excessive strain. So I now encouraged him to go on a 7 days, this one now was daily. He should just go jog for like 15-30 minutes and then rest for a while. He did that in 7 days. Then after the 7 days test, I checked him again, still at the same time in the morning, and it was normal. It had come down to normal. So that was for me a proof that if someone should maintain, I'm not saying that you should have to do it every day. Every day you are jogging. If it's not feasible with you, you can make a routine that's feasible with you, so that you can help create a lifestyle that can help blood pressure. And I don't know, you may be listening to me out there and you may already be diagnosed with high blood pressure. Like I said, it can be controlled, it can be managed. Like for that my friend now, with that exercise, of course now he doesn't joke with it. At least he may not be doing it every day, but at least 2-3 times a week keeps him going, and the rest. So yes, it's necessary we do that. So I would wrap up this live stream with what lifestyle changes can lower blood pressure. For those of us who are listening to me and you already have this high blood pressure, but if you are listening to me and you don't know what your blood pressure is, like, okay, this is December. I believe December everywhere. I don't know if our months of the years are different. So, but let's say in the last 3 months, you've not checked your blood pressure. Please, I will encourage you to please check. Know what the reading is. Last 3 months, you've not checked. Please check. Just, you can walk up to any health facility. I'm sure they'll check it for you free of charge. In my own country, it's actually free of charge. They check for you. Just get to know what it is and then know where to start from. Yeah. So what are the lifestyle changes? Number one, reduce salt intake. Yes, reduce salt intake. I will emphasize so much on regular physical activity. It's very important, and we should never toy with it. Engage in physical activity. I kind of was explaining to a particular crowd that, okay, if you cannot get a pedometer wristwatch that can count your steps, 10,000 steps, all those things, give yourself a time duration. I want to take steps for 15 minutes, 30 minutes, and then get started. You don't need to trek in a long land. You can trek around the place, go up the stairs, come down, just get engaged and it will go a long way. Then weight management. Weight management, it has a lot to do with diet. And I know next time I'll be coming your way if I would share more on weight management control. Then we have stress. Manage stress as much as you can. I tell people, some people feel they can do it all alone. See, life is not like that. Oh. You have to delegate, appoint people, just trust them to do it. Sometimes appoint them and supervise what they are doing. It goes a long way. Eat more fruits and vegetables, avoid smoking, and so on. So I'll be wrapping up these frequently asked questions. I don't know if you have questions on blood pressure. You can still drop on the comments. Even after this live stream, I can respond to it. Thank you so much for your audience. I really, really appreciate. Live, this live stream was strictly on questions, frequently asked questions on blood pressure. And I'm willing to answer as much as I can. And mind you, all the advices here is just basically on preventive lifestyle so that we can live longer and happier and better. Thank you so much. Thank you. Thank you. Thank you. I appreciate you. Thank you.